Hey, you guys. Good afternoon. It's not evening yet. It's still, not too far afternoon. I'm gonna give it a couple minutes before I deep dive into what I'm gonna do. Give everybody a chance to find the live. If you're watching a replay, thank you for watching. Make sure you share this out. Hello, everybody, as you come into this live video, because we're about to talk about it. Let's share this out. I typically do not, push the whole share thing, but
groceries put in the box now, those canned things.
Yeah.
Okay.
Just leave the rice out, because Mila likes to get those. Okay, yeah. Okay. Sorry, y'all. All right. Hey, Michaela. Hello, everybody who's popping in right now. Dun, dun, dun. Oh, it's thundering outside, y'all. A little rain. Look, it's going to thunder and probably sprinkle a little bit. Then the rain going to be gone. But welcome. So this live, we're finna talk about something important, because I need y'all to listen. We got to get this together, y'all. We got to get this together. I'm one person, and I know I can't do it all. There are a lot of people out here that are doing some things, but I got questions. I need to really figure it out. What is really going on in Memphis, Tennessee right now? Has anybody been paying attention? Can someone that's watching right now and in the comments, can you tell me what you know about anything dealing with HIV in Memphis right now? Have you seen anything on social media before I get started? And really tell y'all, I just want to see who's been paying attention and who's kind of had their ear listening, because I know I've seen it a couple times, but I have not seen anybody really address the issue. Haven't really seen anybody address the issue. I've seen people, oh, this, that's awful, but what is anybody even really like? Come on, you feel what I'm saying? So we're gonna talk about this. We are going to talk about this so we can get some understanding, and you guys can kind of, throw out some solutions you think need to be done or something. We just got to figure this out. Listen, Donna, Texas too, baby. Listen, I might need to just go state to state, huh? I might need to just go state to state with what's going on right now, because this is crazy. And then I just heard about a situation in New Orleans with a DJ. Listen, it's a lot going on. I can't keep up. Because we're going to talk about that probably tomorrow or the other day this week, once I do my research and read a little bit. But, man, what's really going on? All right, so I'm doing this live right now because I really want to deep dive into when we have these increased number of new infections and people are coming in contact with this virus. There are a lot of things that I feel are being missed throughout this whole process, whether it's the process of a person contracting the virus, all the way down to the fact of them being in care, receiving care, staying in care, going out of care, all of this stuff. We're about to take a dive into this really quick, okay? So right now, what we're going to talk about is Shelby County, which is Memphis, Tennessee, okay? This is Memphis, Tennessee, more specifically. Now, I just need y'all to understand this is a lot, okay? So let's go take a step back to 2021 and talk about Memphis real quick. So in 2021, Memphis, Tennessee had an HIV rate of 897 per 100,000 people. So out of 100,000 people, if you take that as a whole number, out of 100,000 people, 897 people had HIV, okay? Which is higher than most of the national average. The typical national average is over 380 per 100,000 people. So that is a huge jump from 380 something to 897 something. So let's start there. some people, they're saying that Memphis has some of the highest HIV rates in the country. Okay. And even going back a couple years, in 2015, Memphis ranked 8th in the country for newly diagnosed HIV cases and 12th for AIDS cases. Okay. Donna says, I keep wondering how the new undetectable medicine works for people. So what undetectable medicine, Donna? Because honestly, there's no one medicine that is considered an undetectable medicine. It's just the regimen that your doctor puts you on is the regimen that works for your body, and that is what keeps you undetectable. No two people typically will have the same regimen. For the most part, some people do have, if they're on like the one pill, you do have quite a few people are also on that same one pill, but you can't just say, oh, everybody who is, you know, this demographic, they're going to get a one pill. It doesn't work that way. So there is no one undetectable medicine or anything. It has always been a thing. So a lot of people get confused because the word undetectable is kind of like new terminology within the last 10 years. This has been like one of the new things that you're hearing people say. And I would say even a little over 10 years now. The word hearing undetectable, you're hearing it a lot more. So a lot of people are hearing it, but there also is a lot of confusion with the word undetectable. There has always been a thing of undetectable. So even in the 90s, when people were contracting the virus early on, the goal was still for them to take the medication and to have the virus as low as it'll go. Okay? It's just now we have a word for how low that virus is going, and that's undetectable. So that is what's so important to understand when you're hearing the word undetectable and things like that. Vanessa said all medicine is undetectable if you take it as prescribed, different medicines for different conditions. Absolutely, Vanessa. If you're a person who has cancer, your doctor prescribes you a certain medication. That medication is more than likely going to be something that is going to either assist in eliminating that cancer from your body or lowering the risk of that cancer causing or spreading or making more damage. Even with someone who's a type 2 diabetic like myself, if I do my insulin the way I'm supposed to, my diabetes stays in check. The minute I don't, then I'm going to have high glucose levels, if that makes sense. So same thing. All medicines do some type of undetectability for people. All right, so now back to Memphis and Shelby County, okay? So we've established that in 2021, they had a rate of 897 per 100,000 people. The national average at that time was 384. So that's a huge gap from their average to the national average, okay? And at that point, they were saying that Memphis had some of the highest rates in the country. Now, in 2015, I'm just kind of reiterating because a couple of people have also joined in. In 2015, Memphis ranked 8th in the country for newly diagnosed cases and 12th for AIDS cases. So when they say 12th in AIDS cases, that's not meaning somebody got infected with AIDS. Okay, I need y'all to understand. AIDS is not any one simple thing. AIDS is a syndrome. Okay, Vanessa, got you. AIDS is a syndrome. So that means that the person is already diagnosed HIV positive and they're just probably not taking their medicine. Is how they're going into an AIDS diagnosis. So out of the people who are in that county who are HIV positive, that means that there are a lot of people who are not taking their medication who are going into an AIDS diagnosed state. Okay? Now, as of May 2024, this is very important because this is going to be our segue into what I want to really say. Okay? In May of 2024, the Shelby County Health Department reported an increase in HIV infections, especially, listen to this, in people ages 14 to 35. Are you listening? 14 to 35. 14 to 18 is considered underage and teenagers. 18 to 20 are our young adults who have not crossed out of, well, really 19, who have not really crossed over into that threshold of You could legally drink, you could legally buy cigarettes, that type of thing, depending on the state and all, all that stuff. However, from ages 14 up to age 18, so 14, 15, 16, and 17, what is happening? All right. The Tennessee Health Department has estimated that the HIV rates in Shelby County have increased 36% since 2018. And the HIV rates among ages 15 to 19 years old increased 40%. Okay? And basically, they're encouraging everybody to just go and get tested. So, all right, let's jump right into it. First of all, what is really happening in Shelby County? What is the health department really doing to make sure that, especially those who are underage, those 14 to 17-year-olds, what are they actually doing to make sure that they understand the risk of contracting an STD, what it means to practice safe sex, and what are they doing? What exactly are they doing? Because from what I'm reading, I'm not seeing a whole lot of anything that's telling me anything. What are you doing? Oh, okay. Boom. Here you pills. Let's go. Do we have in Shelby County, and I know I might have some people in here in Memphis, are you seeing testing buses out there? Are you seeing condoms being passed out or free condoms? Do you guys have enough clinics? What is really going on in Memphis, Tennessee? I know we have to look at a lot of different things. You have social determinants of health that we have to look at, because definitely if you're someone who's in a lower income situation, your access to resources are limited. That is something we know, okay? However, that does not mean that the county should drop the ball when it comes to educating. Those people still deserve to be educated. I can guarantee you that out of the number of people who, and I believe it was saying it was estimated about 41,000. That's what I kept finding. They kept saying there were 41,000 new infections. And my thought process is wait a minute. What is happening? Is there sex education in the school system in Memphis, Tennessee? Now, granted, this is how I feel. This is my personal thought. When it comes to sexual education, the start of that needs to be at home. As parents, you need to be talking to your teenagers and your young adults about sex. Stop being afraid to talk about it. I know it was always considered this taboo topic. Sometimes depending on your religion, it's one of those topics. Oh, we don't talk about sex. Oh, sex is bad. We know sex is bad, but are you really bad in the sense of things like this can happen? But are you explaining to your children why you're saying sex is bad and don't do it until you're a certain age? A lot of times, no, they're just putting a fear in them. Oh, no, don't do it. Sex is bad. No, explaining them. Sit down with them. First, you need to start by understanding exactly what about sex does your child already understand. Because I can guarantee you, even children as young as 8 and 9 years old have some thought process of what they think sex is. Okay? Some of them may think sex is just, kissing. Some of them may think that it's hugs. Some of them may think that it's just, touching somebody in a certain place, things like that. They may not know the invasiveness of it. But how are you going to know how to educate them if you're not reaching out to your child and having a conversation to even find out what level or where you need to start with your education? That is the important part. Okay? So that's what you got to do. Don't be afraid. If you don't know how to even approach it, there are resources available for you. There are so many online resources. I'm here. There are other advocates out here. There are so many people and resources that you can reach out to figure out where do I start if you don't know the information. It takes no time to get educated on something. If we can take the time to do all these other things that are available to us and easily accessible to us, we can do that same thing with this type of information and education. Okay? And yes, LaCynthia, they definitely, I know churches, I know a couple churches who don't shy away from this type of discussion. They welcome it. But there are a lot of churches who do not want this to be a topic of discussion because, and I'm gonna just keep it real, because guess what? All the way from the top to the bottom of the officials of the church, they ain't doing what they supposed to do in their own life. So guess what? Sometimes they don't want it to hit too close to home. They want to be able to keep doing what they're doing behind the closed walls and the doors. And they don't want to bring it up because now it's going to cause them to question themselves because of the things that they're doing. It's going to bring the conviction, okay? Look, we ain't going to jump in there, but I can. Don't let me get started. You know, put a little mini sermon up in there. But it's important to do this. And I do feel like if we get all these other things from church, you know, if you need help, come to the church. If you need this, come to the church. Well, guess what? My child needs to be educated on this. Why we can't come to the church? You want them, especially if it's a church who's wanting the child to learn from a biblical standpoint. You know, if it's a church or religion who's wanting them to learn from what you're teaching. If you're teaching no sex before marriage, no this, then why not bring the educational aspect of it also in there? Because granted, you could talk to a teenager or a young adult till they blue in the face, but is that going to stop them from going to have sex? No. So in the event that they still go out there and do the thing you're telling them not to do, they already know what they need to do. Protect themselves. Okay? Shout out to Akron, Ohio. Shout out to everybody that's watching right now. Make sure y'all are sharing this out. Make sure you guys, you can tell me in the comments where you're from. I would love to know where everybody's watching from. I might not shout everybody out if y'all type too fast, but I got you. Listen, it's just one of those things where we have to open our mouths and talk, period. Okay. Now we've established the parents part of it. Okay. Because granted, after they get a certain age, they're out of the parents' care for the most part, and they're adults. So we've established where it needs to start at when they're 14 to 17 years old. This needs to be happening in the home first. Okay. Now, once they're at that 18 to that 35-year mark, because remember, the window that they're saying for these new infections in Shelby County, which is in Memphis, Tennessee, was from 14 to 35. So now if we're looking at the 18 to 35-year-olds, now where does that, needs to happen there? Right there, it needs to also be some type of accountability on that person themselves. As adults, you have to take accountability for yourself and your health. Stop allowing the health of someone else to determine your health. Why are you guys doing that? Have I not told my story enough to show y'all that I actually trusted somebody else? Not in the sense of trusting what they said, you know, that I didn't go and get tested as well. But just the fact that trusting the word of somebody else or saying, oh yeah, I'm good, so that means you good too. No, stop doing that. The accountability has to lie on the person that is you. It has to lie on you. Okay? You have to take control of your health. You need to go to the doctor and get tested. If you are not sexually active, once a year is fine. Go get your yearly physical and say, listen, while I'm getting my yearly physical, can you include STD and HIV testing in my lab work? And you get it done once a year. Even if you're married. If you are in a relationship, and say maybe you're a person, maybe relationship lasts a year, however. Anytime you get a new partner, you want to be getting tested, okay? You want to get tested at least 3 months from the last sexual contact you had with that person. And as crazy as this sounds, people forget when they jump from one relationship to the next that there's a window that they need to really wait. You ever hear, you know, some people say, oh yeah, I just need time to heal. I need to do this and that. Listen, I need you to really seriously take, look, I got hiccups now. Mila, can you bring me a water, bring me my cup? Mila, my cup by the lamp, my Chick-fil-A cup. Can you bring it to me? I got hiccups. But we really need to remember when you go from, thank you. When you're going from one relationship to the next, from whatever that last time is you had sex with that person, you need to take a moment. You need to stop. And at that 3rd month mark of you not having sex with them no more, before you've had sex with anybody else, you need to be going to get tested. Your test is negative. Guess what? You want a new partner? Have at it. You want to get that new partner tested? Like, listen, I just got tested. My test negative. Well, let's go so you can get tested too. Of course, if they choose to not get tested, or they do not have recent lab results to show you, and when I say recent, I'm talking about within the last 3 months at least, they can't show you those test results, then you need to run for the hills as high as you could go. Okay? But you need to be taking accountability and getting yourself tested as much as you need to. Don't over-test. And when I say over-test, I'm saying don't be like, oh, every 6 months, every 3 months, I'm going. If you've been negative every time within a year, you're negative. The virus is not going to just be somewhere high and then 5 years later it's going to pop up. Hey, girl, I'm here. I've been here. No, the virus does not work that way. The virus, the HIV virus type 1, it does not wait. That thing fast, okay? It ain't got time to be around here waiting. That virus wants to get in there, invade you, take over, and make you sick. That virus ain't waiting on nothing. So within a year, if you're still testing negative, you are negative, okay? Know that. All right, so that's the second part of where the ball is getting dropped. The personal accountability. The third part is, what is the health department actually really doing? And I kind of said this a little bit earlier, like, are they putting these testing buses out here and maybe offering small incentives for people to come and say, oh, give you a little $10, $25 gift card if you come and get tested? You know, something. Are they doing testing drives? Are they passing out information in these neighborhoods where they know the rates are high? Because wait a minute, let me pull my thing back up. Because if you're in Memphis, Tennessee, I'm about to tell you right now the zip codes that are highly affected. Okay? Because guess what? Not only is it HIV, I'm highlighting that because that is a topic that I primarily discuss. However, it is HIV and syphilis that is running as rampant as it is running in Memphis, Tennessee right now. So, okay? Like I said, and this has been like a 6-year trend also of the increase, but they had that spike that happened. And it's ages 14 to 35. Let's see. So, in Shelby County, they had that 30% increase since 2018 for HIV rates. But syphilis rates increased by, guess what? Who want to guess what? Who want to tell me in the comments what percent you think the syphilis rates increased to? Anybody? Just put your percent out there. How much percentage do you think the syphilis rates increased to? Hey, Peggy. Hello. Hey, everybody. Hey, Wanda. Thank you. Wanda in Virginia. Wanda said 85%. Anybody else got any guesses? Anybody? I'm gonna see if anybody else put a guess. LaCynthia says 65%. Well, let me tell y'all, okay? The percent increased by 100%. 100% increase in syphilis rates in Shelby County. Memphis, Tennessee, 100. So between 2018 and 2023, HIV rates among those ages 15 and 19 increased by 40%. The same age group saw 150% increase in syphilis rates. According to the health department there, okay? Now let's talk about the certain zip codes in Shelby County that have higher STD incident rates, okay? Than the whole county overall. Because remember, you have an overall incident rate, but then you have a zip code incident rate as well. So there are some zip codes in Shelby County that are higher than the overall rate, okay? Those zip codes include 38103, which is the downtown Memphis area. 38107, which is the North Memphis area. And 38109, which is the Southwest Memphis area. And then you have other zip codes affected that include 38105, 38106, 38108, 38114, 38118, 38126, and 38127. Okay? And the statement from the person at the health department, and this is Dr. Michelle Taylor. This is her exact quotes, okay? All residents of Shelby County should be aware of their health status. Getting tested is crucial for detecting and treating HIV and other sexually transmitted infections early. That's what she told the news people, and that's what they put in this article, okay? Now, yes, you're telling people that they should go and get tested. Are you telling them, what are you telling them? Hey, we need you guys to, like, at this point, if you got this amount of high rates, you should be getting these people in there in droves to get them tested, because guess what? Obviously, with that amount of new infections in those zip codes, that means there are a lot of people in those zip codes who are not in care. They are not getting the HIV treatment that they need to be getting. What in the world is going on? The ball is being ultimately dropped when it comes to people staying in care. Remember at the beginning, if you weren't here, I said there are certain aspects you have to look at. You got to look at the people that are in care, getting care, or who have fallen out of care. That means that there are a lot of people who have fallen out of care, who are not undetectable. They are sleeping with people. They're not disclosing their status, or they don't know their status, and they are transmitting this virus to other people. Hey, Wanda, actually, I do have a podcast. Haven't done it in a while because I love the live aspect, honestly. I mean, yeah, I could sit there and I could record a podcast and just run my doggone mouth. But I love the interaction. I love the live interaction, like how you're typing to me right now. I just love that way more than, like, audio podcasting. This is my podcasting, if that makes sense. And I'm getting ready to do interviews again. So last year, if you've been following me since last year, which I see your badge says 5 years. Oh, so you've been following me for a while. So last year, I did about 8 interviews where I allow other people to share their stories and things with me.
Is this blender yours or Michaela's?
I don't know. We both had one that was kind of similar. So I don't know.
This one has a power button.
Who's on this here?
I don't know. That might be mine.
Michaela got one, ain't she, on her count, ain't she?
But she had left one with me too. There's two boxes in there.
I don't see but one.
Well, then that's
One
mine.
of the blenders was out. It's out by the
One on the out by the
Mine looks like that one.
So this
With
There's
that.
one inside here. That's why we don't know what
Oh.
will take one.
Hey, Miss Mary. Where's the that's probably mine. Because I left mine in the box. That's probably mine.
Yours, then.
Hers was not in the box, I don't
That
think.
must be the one on the counter.
Yeah. Because mine looks just like the picture on the box.
You know you getting ready to try to move out. What are you doing? Are you working or you just...
Yes, I'm working.
Yeah,
She
right.
said, "Do you want this put in the box?"
Yeah, you can put that in the box. Leave the stuff that's at the very bottom, the other stuff like the Ziploc bags,
Yeah,
The Fortsons.
We put it on the second shelf where you can see it.
Okay, and the cups and all that. Just leave that stuff, yeah. Okay. Sorry, y'all. But yeah, so this is kind of what I really like a lot more. So that's why I'm like, okay, what is the health department they're really doing? Because that sounds like a lot of people are out of care. I'm actually going to take some time later and look and see exactly how many AIDS service organizations they have in the area, who's servicing these people, because if they don't have enough, they need more. They need something's got to change for this, because that many people in there should not be falling out of care. That was downtown Memphis, North Memphis, and Southwest Memphis. That's a huge area. That's how many zip codes? 1, 2, 3, 4, 5, 6, 7, 8, 9. That's like 10 zip codes of people. So yeah, something's really got to be done. I see a link here said here's some places in Shelby County you can go and get tested. Let me see what's they got going on here, child. Cause there's a lot of places. I'm seeing on here about, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So there's about 15 places that they've listed on this website in Shelby County that people can go and get tested. You got places like The Haven, Hope House, Latino Memphis for people that are Latino and speak Spanish. You can even go to Regional 1 Emergency Department. A lot of people don't know. You can go to the emergency room and get tested. Just tell them you want to come in and get an HIV test, and they can do it right in the emergency room. They even have a website where you can order free take-home HIV tests. You don't even have to go and pay for one in the store, which that's available to you, and you don't want to wait for one to get shipped. They have a website for you to get free HIV tests, home tests. So what are people doing? They have a couple AIDS service organizations on here. So there's no excuse. It just things need to take place that are not taking place. Simple as that. It's just that simple. So that's kind of what I wanted to talk about, because I saw this. I was like, oh my gosh, this is crazy. Now I got to sit over here and investigate this other thing that I'm probably going to talk about tomorrow. There is a DJ, and y'all can go and research this too, because I'm going to do a deep dive. There's a DJ right now in New Orleans who they're looking for, because he's at least 10 people have come forward saying that he's giving them the HIV virus. And he's been doing it for a very long time. So there's pretty much going to be more people. Somebody named DJ, what is his name? DJ Hardhead, NOLA, in New Orleans, Louisiana. We already know Louisiana has high rates as well. What is going on? So I'm going to do a lot of research and talk about that tomorrow. We just got to get this stuff, like, we really got to take accountability, you guys. But I'm going to end this live now. Hope you guys are having a great day. I just wanted to come over here and share this information. Make sure you guys share this video. Share it out. Thank you, guys. If you know anybody in Memphis, Tennessee, please let them know they need to watch this so to get some of this information and just really be aware. Parents, please, I hope you guys take the advice as far as learning how to talk to your children about STDs, HIV, safe sex, abstinence. I'm going to always promote abstinence as the thing that you do with your children and young adults first. However, we know that they're not going to always listen. You know. Tamika, girl, listen, I'm about to take a deep dive because I got that information today. And so I'm about to take a deep dive because I heard they looking for him. They can't find him. They can't find him, girl. So, it's crazy out here. But I thank you guys for tuning in and watching. Don't forget, if you guys want to get any one of my 3 books, you can go to my website that's pinned in my pinned link, or I'm going to pop the link up so you guys can see it really quick. Did it pop up there? Okay. So that also is a featured link. My autobiography right now is on sale for $8. You can get the other books. You can get bundles. But those are available to you to purchase at any point you want to purchase a book. Just you guys showing up and supporting and following is enough for me, honestly. So I don't want people to feel like they're obligated to like, oh, go and buy a book or anything. The option is there and it's available for you guys. I do appreciate everything that everybody does. And that's that. Diamond said about a year ago there was another DJ spreading it to black females. Glad he got locked up. Yes, I know exactly what you're talking about. I can't think of his name right now, but yes. I bypass the abstinence talk and be realistic and give them the tools to think for themselves and make good choices. That is great, Tasha. That's a great thing to do as well. I always just say the abstinence part only because when I'm saying abstinence, I'm thinking more of when you're getting young, at a younger age. So like 8, 9, 10 years old, up until that like 13-year-old age, because they're still in that. Because granted, listen, there are elementary age kids who are talking about sex, who are experimenting with different little things that they think is sex. So you still want to talk to them. Yeah, you need to not do any of the abstinence. Like, that's when I would really stress the point of abstinence, when it's at that younger age level. Once they hit that age level where, say, maybe it's one of your female children, and they're going into that stage of getting ready to have development things happening, you know, our women little issues and stuff, that's when I would really talk to them about it, because they're going to go through body changes. They're going to, you know, how the puberty is going to hit hard, and you want to make sure they understand, yeah, there are places nobody should be touching you or bothering you or doing anything. So you want to really talk about that stuff and just, you know, be that parent, okay? That's the only thing I can really stress. Be a parent. Be the parent that they really need you to be in those times. Because guess what? If you do not talk to them about it, somebody else is. And they're going to be getting probably the incorrect information. And you don't want that to happen. You don't want them to get incorrect information from anybody outside of the household. Now, they may get information, and what if they hear it and they be like, you know what, I done talked to my parents, that don't sound right. And then they come to you and say, well, I heard such and such. And that is when you can also use that moment to say, you know, a lot of people think different ways, but I'm sitting here telling you as your parent, this is what it is. And you can use references. There are so many websites that you can go to and reference things. So your kid don't feel like, oh, my mama just telling me this because they just don't want me to do it. No, I'm telling you this, and I'm going to show you, okay? But I appreciate you guys so much. If anybody ever has questions, don't feel like you can't message me. I do have an automated messenger that answers, but typically I answer people all the time. If you absolutely feel like you just want to have a phone conversation with me, I do have availability for people to actually schedule an appointment and time with me. But typically, if you're just inboxing me and asking simple little questions, I usually reply. I only really stress the importance of scheduling an appointment with me if it's going to be something where I need to really have an in-depth conversation, and it's going to be longer than, you know, just a 1 or 2 line response. Okay? So I appreciate you guys so much, and I'll talk to you later. Thank you, Tasha. Bye.